Autism spectrum disorder is a diagnosis that envelops an extremely diverse group of individuals. One of the few consistent links between people on the spectrum are salient socialization deficits. Characteristically, individuals with autism have difficulty sustaining conversations, processing social cues and messages as well as emotions, responding to said cues, messages, and emotions with appropriate behaviors, initiating spontaneous language, play, and conversation turn-taking, maintaining an interaction, and requesting, commenting, and sharing. Children with autism find joint attention, imitation, and the production of appropriate responses to social stimuli challenging. These skills are the foundation of complex social interactions, and the difficulty children with autism have in implementing these skills manifests itself later in life. Let's take a closer look at imitation and joint attention, starting with imitation. For example, a child may be running in a situation in which it is inappropriate to run. They then may notice that their peer is walking, and they may engage in a similar walking behavior. This is how imitation aids in the development of social skills. Bandura's social learning theory states that individuals learn by observing others and then implementing observed skills. Along this vein of thought, classroom environments that integrate children with autism with their typically developing peers should enhance the social skills of children with autism. However, the research has shown that simply including individuals with autism into integrated classrooms is not enough to increase social skills. It simply takes more for children with autism to learn new social skills than observation, perhaps due to their difficulty in the skill of imitation. Joint attention occurs when an individual is attending to a certain stimulus and looks to a peer to see if they are attending to the same stimulus. Another reason typically integrated classrooms may not be enough to enhance the social skills of individuals with autism is due to the tendency of typically developing peers not to interact organically with their peers with autism. This is perhaps due to negative expectations. The affect-effect theory, which states that expectations affect emotions and effort, is thought to play a role in the lack of attempts of typically developing students to engage their peers with autism. This phenomenon could lead to further social isolation for a child with autism, decreasing the amount of time and the quality of exposed social interactions. Due to all of these variables, there has been a call within the education and psychology communities for more structured, inclusive environments. Many structural strategies have arisen with mostly positive results, although there are pervasive limitations. This video will discuss some methods and results behind the structuring of inclusive environments, using peers as the interventionists in an attempt to enhance the social skills of children on the autism spectrum. One challenge facing educators is the selection of peer models. To illustrate this conundrum, let's meet Sally. This is Sally. Sally's teacher, Harold, asked her to be a peer interventionist for a child in her class with autism. He chose her because of her strong academic and attendance record, as well as her strong leadership and social skills, and her tendency toward pro-social behavior. While Sally was a fantastic peer interventionist, children with autism face difficulties generalizing learned skills if they're learned through only one peer. Thus, an intervention method including a wide array of children, such as class-wide peer tutoring, may be beneficial. Two interventions that showed favorable results in the use of multiple peer models included class-wide peer tutoring and the buddy system. Class-wide peer tutoring is one intervention that yielded overwhelmingly positive results. It is a cooperative learning strategy that directly targets reading skills and indirectly promotes the interaction of children with autism and their typically developing peers. In this intervention, teachers assign students a tutor for the week, and together the tutor and learner work on understanding and articulating a short passage. Each week, the teacher assigns pairs. In the pairs, there will be a tutor and a learner. The roles of learner and tutor alternate during the week. Following the completion of a full week, each child is assigned a new partner. Following the structured period of interaction, unstructured social time ensued. The results of this intervention were overwhelmingly positive, with an increase in reading comprehension as well as social interaction between children with autism and their typically developing peers. When surveyed, most students said they enjoyed the program and learned during its tenure. Beyond this, teachers favored the program. One effective intervention was completed by Lashy and Heflin in 2000. They implemented a buddy system that yielded positive results in the enhancement of social skills and in combating limitations associated with long-term skill generalization. The system design is simple and easily executed by a teacher. Firstly, there's training beforehand in which they explain to the children that even if someone was different, they could still be a friend. This can be considered a form of sensitivity training for kindergarten-age students and is a unique and valuable strategy. Following said training, every student would be paired with a different buddy every day, and they were instructed to stay, talk, and play with them for a set period of free play time. The partners would then be switched to ensure generalization. There are three main factors that were present in successful interventions. As previously stated, generalization is of concern. It is important to ensure that the intervention is occurring in a naturalistic environment, such as the home or a classroom, and with multiple peers as tutors. The second important aspect of successful interventions was that they provided children with a choice. Namely, they allowed them to choose the toy that they played with. This colored positive interactions between the target child and their peer therapist, model, or tutor. A naturalistic environment, multiple peer tutors, and a choice provided for the child usually resulted in a successful intervention. While the research regarding peer-mediated therapies yielded mostly positive results, there were pervasive limitations. For example, many of the studies had small subject designs, older children, and children on the high level functioning of autism. More research in this field needs to be conducted to correct for these limitations, because this is very important. The development of social skills leads to better long-term outcomes for individuals with autism. We know that inclusive environments are the way to go for both people with autism and their typically developing peers. However, we know that is not enough. We should all look into peer-mediated strategies to ensure the enhancement of social skills for individuals with autism.